Hey, good morning, guys. Kirsten here with my, day in the life of a CF patient blog. I need a name for it, something shorter. But, anyways, this is my last blog from the hospital. Going home today, yay. And they're taking this PICC line out, so I don't gotta go home on IV antibiotics for 2 weeks. But I do gotta go home on antibiotics, of course. But I won't have to have this in my arm. So that just makes me so much more excited about going home. And my birthday is coming up, so I won't have a PICC line in my arm for my birthday. Y'all don't understand how excited I am. But anyways, I've been getting a lot of feedback, a lot of questions. I'm glad that people are actually like paying attention to what I've been posting and saying. So I've got some good questions, bunch of questions. Sorry, it looks like jibber jabber, but it's a bunch of questions. And I'm gonna start answering questions in my blogs. I'm gonna try to, answer them as good as I can, or some of the answers, of course, are longer than the questions, but that's a given. The first question that I'm going to start, out answering here, it was actually a good question, is can you cure CF? You can't. There's no cure. You just deal with it pretty much. You live with it. It's just something that, like, sorry, it's just something you just got to deal with. You kind of just take it day by day. There's not much you can or can't do about it. When you're in pain, you just gotta take your medicine. Sometimes you gotta come to the hospital and get IV medication. Hence why I'm here now. Sometimes you can, just take like some Tylenol or some ibuprofen and be fine. Sometimes you have to come into the hospital and get like morphine or, fentanyl. You have to have something that's like stronger, because the Tylenol and like Advil, it's just not working. So you're not just gonna continue to take those pills. You have to come in and get medicine. So like I said, there's not a cure for cystic fibrosis. I wish there was, clearly, but I don't regret anything that I've done or gone through dealing with cystic fibrosis, because being in my condition, it's brought me closer to a lot of people, is because they genuinely want to know about me. So having this is like a blessing in my eyes. It's a blessing if you depend on how you look at it, I guess. Another one of the questions that I was going to answer on here, like, somebody asked me, how does CF affect you? Like, does it affect you like at different ages, such as like I'm 25 now, going on 26. So like, how has CF changed since I've been little, or how has it affected me? It affected me more as I got older. When I was little, I was sick, of course, but as I got older, it started affecting me more. Like, really around when I got to high school is when I noticed that I was sick, getting sicker a lot. And like the past couple years, I've been in and out of the hospital or in and out of the emergency room at least once a month. Like, literally, I go to the emergency room almost once a month, just because sometimes I can't deal with the pain. So it affects you, but it affects CF patients different than others. So it just, like I said, it just depends. Because like when I was younger, I didn't have as many issues as I do now. But I was born with cystic fibrosis, but I wasn't diagnosed with it until I was like 3-4 months old. So we didn't know for a while what was wrong. Well, my mom and dad didn't know for a while what was wrong with me, or why I was so sick all the time. But we ended up having to go to the emergency room one time, and Dr. Davidson, everybody who goes to Carl, most people know him, he ended up doing a sweat test on me, and they found out I was a CF patient. So I was diagnosed with cystic fibrosis, and I've been dealing with it since. Me, my family, my friends. It affects not only me, it affects everybody around me, because, you know, sometimes they have to stop what they're doing to tend to me, you know, tend to caring for me and my needs, you know, even when I, you know, even now. So, you know, I have friends, you know, they have to, they don't have to, but they, you know, they choose to. They could be somewhere, and I'm like, I'm sick, I need to go to the emergency room, and, you know, they're right there. So, you know, it not only affects me, it affects my friends, my family, it affects everybody around me. You know, so it's something, but something hard to deal with. But over the years, you know, we've all gotten used to it. We've got accustomed to it, I guess you can say. It you know, it affects school, work, social life. Like, it affects a lot of things. Like, I missed a lot of school. I missed a lot of school dealing with cystic fibrosis, but I always did my work. I always, you know, did what I needed to do. So I graduated, you know, so that's good. But it definitely affects your life, like, because when you have a attack, as I call them, everything stops. Nothing else matters but going to the emergency room. You know, you could be sitting, like I said, at school or at work. You just gotta stop and go. You know, take care of yourself. Everything else is on pause right now. Like, me being in the hospital this past week, everything is on pause at home. You know, like, I mean, I don't work due to my CF, but still, you know, like I said, everything is paused until you back to normal life, you know, well, as normal as it can get. But yeah, a lot of people ask me, how is it pronounced? I actually have a friend, he he makes jokes about how it's pronounced all the time. But it's pronounced cystic fibrosis. And, you know, there's a foundation actually called 65 Roses, because that's a lot of people, I guess when they, like, a long time ago, kids used to say 65 roses or 65 groceries because they couldn't say cystic fibrosis. And there's actually, like I said, a foundation called 65 Roses, but it's pronounced cystic fibrosis. And you guys can look it up. You can Google it. And like I said, if you Google it, and you have other questions, you can always ask me. Like I said, I've been dealing with it 25, 26 years, and every day is different. Literally, every day is different. You can be happy-go-lucky, and then in the blink of an eye, you just sick, in pain, hurting, don't want to talk to nobody, don't want to look at nobody, don't want to do anything but just lay in a dark room. It can make you depressed. It can make you very depressed, very, very depressed. I myself know that firsthand. And that's another reason I kind of want to do these videos, and, like, open up, because keeping it boxed in, not such a good idea. You know, you gotta open up, to be open to share your story at some point in your life. And I think that's why I decided, you know, I need to go ahead and do this. I need to go ahead and open up and share and let people know what's going on. Because, like I said, one of my other videos, there's people who've known me for years, 10 plus years, and didn't even know that I had cystic fibrosis. They just know that I'm in the hospital a lot. But they never knew why, and they never wanted to ask, because sometimes people get offended when you ask them, why are you in the hospital, you know, or what's wrong. But me, I used to get upset about it, but me now, when somebody asks me, I'll tell you, I'm CF patient. I'm in and out of the hospital a lot. I have diabetes. Chronic pancreatitis is it all comes with CF. So, like I said before, if you want to ask me anything, you can always ask me. You don't have to be like afraid of offending me with any question. You can ask me any question. The question I get asked the most though dealing with my CF is, can you have kids? You can. I personally myself, I would rather not have a child because there's more than like a 50-50 chance that my child would have cystic fibrosis. And I wouldn't want to see a baby go through what I go through at all, or what I went through. I just, I, I don't know. But you can, like I said, you can have a child, but they also tell you it's in your best interest not to, if that makes sense. But you can. Me, myself, Kirsten, I just don't want to try to bring a child into this world and deal with this, and on top of that, I'm still dealing with it. So it's like, I have a child, I'm not going to be in my child's life if I'm always in the hospital. I don't know. There's just a lot of different reasons as to why I personally wouldn't have a child. But, I mean, who knows? Things could change. But as of right now, it's just not for me. But having cystic fibrosis, you can have babies, you can, but it's a risk. Let's just say that it's a big risk, very big risk. Another question I was asked is like, can it be transmitted through blood, or like, can you like, can you get it from somebody? Like, if I don't know how to say this. Like, say me and you, or me and someone are together. They can't get cystic fibrosis from me. Basically, you can't just pass it on like that. You cannot pass cystic fibrosis like a sexually transmitted disease. You cannot. That's not how it works. That's not how it works at all. And I don't mean to laugh like it's funny, but that was a question that I was asked, and that was a serious question. But no, excuse me, no, you cannot get cystic fibrosis from like another person per se. Like I said, if I was to have a child, then there's a chance my child would get cystic fibrosis. It's like genetics. But no, I can't kiss you or be intimate with you and then you wake up 2 days later and have cystic fibrosis. Doesn't work that way. No, at all. If it did, a lot more people would have cystic fibrosis. A lot. But because if it was just like passed on like that, then, but yeah, like I said. Another question before I wrap this up is, how has cystic fibrosis changed my life? I don't really know how it's changed my life, because I've been dealing with it since I was a baby. So it's not like I was just diagnosed yesterday or a few years ago. So it really hasn't changed my life, because my life, this is normal to me. It's not normal to other people, but this that I go through, like, this is normal to me. So like when I meet people and they see I'm in the hospital, like, oh, I'm sorry, or I hope this is nothing new to me. That's why I'm always so like upbeat, somewhat upbeat when I'm in the hospital, because this is my life. This is my everyday life. This is just a day in the life of Kirsten, literally. Or you know. So it hasn't changed my life. It kind of derails my life a little bit sometimes. Takes me off path sometimes, but it hasn't changed my life because, like I said, I was born with it. So it's not like I was just diagnosed a few years ago and like my whole world was just flipped upside down and turned around and I had to change this and start doing that and start doing this. And the only thing that's really changed my life with CF is diabetes. That was something new because I was diagnosed with diabetes 4 years ago. Yeah, 4 years ago. So that was like the only thing that really changed. But that really didn't change. I just had to start taking insulin and poking myself. And I'll talk about that, of course, in another video. I'll talk about the medications I take, how many different medications I take. I'll talk about my breathing treatments, what I do when I'm at home bored, which is always. That's another reason I started these blogs, these video blogs. Just like I said, it's a day in the life of Kirsten, a day in the life of a CF patient. I want to open up to you guys and tell you about my life and being an African American woman with cystic fibrosis because, and I say my race because, the main reason because cystic fibrosis is not common in African American women. That's the number one thing I should have started off with. But cystic fibrosis is not common in African American women at all. It's not common. It's not just African American women. Sorry, it's not common in African Americans. It's more common in Caucasians. But and I'm fully African American, but I ended up with cystic fibrosis, so it's really rare. Not that rare, but it's rare. So like I want to open up and let you guys